been covered. So we'll discuss one by one. Okay. So OSCE number 1, what is biophysical profile? What are the components of biophysical profile? And what is the maximum minimum score? And how do we interpret this score? So we don't have, just write the components of biophysical profile. What's the maximum minimum score and how to interpret the score? So where would I see all the replies?
In the chat box, can you open the chat box?
Yes. Okay. Okay. So Ankita has written NST, amniotic fluid movements, respiratory rate. NST. Tell me how many components are there? 5 components. Correct. Perfect. So 5. What's the minimum score? What's the maximum score? Can you label those 5 components? 0 and 10. Okay. So there is no 0. 0 and 10. Okay. Fetal heart rate, breathing movement, AFI, and tone. 10. 10 is maximum. Okay. 0 and 10. AFI body movements. Jaya is saying breathing movements, tone, and fetal heart rate. Okay. Okay. So let us see the answer. So biophysical profile is used for the assessment of fetal well-being, right? So it is a sonographic scoring system performed over a 30 to 40 minute period and designed to assess the fetal well-being. So here, there, as you all have rightly mentioned, there are 5 components and each component has given 2 points, right? So if the breathings, so the components are breathing, movement, tone, amniotic fluid, and non-stress test. Okay, each component has got 2 points. There is no one marking. So if this breathing criteria is satisfied, the fetus will score 2. If it doesn't get satisfied, then it is 0. Okay, movement criteria gets satisfied, then it is again 2. If it doesn't get satisfied, it is 0. Okay, so yes, so the minimum score is 0 and maximum score is 10. Okay, so there is no odd number here. How do we interpret? So what is good and what is bad? So any score beyond 8 is good. Any score below 4 is, you need to worry about the baby. So if the score is 8 to 10, it is reassuring. There is no fetal asphyxia, acid-base status is good, the fetal well-being is good. If the score is 4 to 6, it is suspicious and it requires reevaluation. If the score is 0 to 2, it means abnormal fetal testing and we need to intervene. Okay? So biophysical profile, everyone should know. Okay. Which blood vessel is sampled for the Doppler ultrasound during fetal surveillance? And right common Doppler indices used for obstetric. I can't see. Oops, sorry. For the obstetric application. MCA. MCA is used to assess fetal anemia. Okay, RI, PSV. Uterine artery, MCA. Okay. SD ratio. Yes. Which artery? Umbilical artery, ductus venosus. PI index. Okay, tell me first which artery or which vein? Umbilical artery. Rani is saying umbilical artery. Sanika is saying umbilical artery. Ankita is saying ductus venosus. Umbilical artery. Umbilical artery. Umbilical. Okay. Yeah. So umbilical artery is used for the indices for fetal surveillance. And what are the indices we use? RI, PI, and SD ratio, right? So umbilical artery is used. And so so common Doppler indices used a SD ratio. When we say, so can you see this graph? Okay, see this graph. This is the umbilical artery Doppler. Okay, this S is the peak systolic velocity. D is for the end diastolic flow. Okay, end diastolic flow velocity. And this marking is actually average flow velocity over one cardiac cycle. Okay, so when we say SD ratio, so S stands for peak systolic and D stands for the end diastolic flow velocity. So that is SD ratio. When we say PI, that's pulsatility index, that is S minus D divided by A, and that A is average flow velocity over one cardiac cycle. And there is resistance index or resistivity index. So that stands for S minus D divided by S. S is peak systolic velocity minus end diastolic flow velocity divided by peak systolic velocity. Okay. So that is, so whenever you counsel or you see the reports, when you go for any delivery or section, please go through the fetal ultrasound and you'll see all the reports and the Dopplers. It's good to see all these reports. Okay. Okay. So this is asking number 3. Identify the graph. What do following findings signify? Early deceleration, late deceleration, variable deceleration, and sinusoidal pattern. So what is this graph? Ankita is saying CTG. Jaya is saying CTG. Sanika is saying graph. Mayur is saying variable. What is the graph type? What is this graph? Dr. Rani is saying CTG. Ankita is saying variable. Mayur is saying CTG. Dr. Rani is saying variable. Oh, okay. So this graph is cardiotocograph or cardiotocography. Correct? So you can see that this part is the fetal heart rate activity, is a baseline fetal heart rate. Okay. With the acceleration phases. And this is the uterine activity down. Right? So this is a cardiotocograph. Now what do you, so when there is early deceleration, what does it signify in terms of baby? When there is late deceleration, what is happening when there is variable deceleration? Okay. Mayur is saying engage head for early deceleration or late deceleration? Early. Okay. Early is uterine contraction. Head compression early. Late uteroplacental insufficiency. Placental insufficiency in late. Okay. Late fetal distress, uteroplacental insufficiency. Variable cord compression. Variable cord. Variable cord compression. Okay. So let us see what is it. It's a cardiotocograph showing normal fetal heart rate and variability. When it is early deceleration, it is head compression, it could be benign. When it is late deceleration, it also could be benign, but late deceleration, if it lasts for a long time, beyond 10 minutes, then it could be a sign of uteroplacental insufficiency. If it is a variable deceleration, then it indicates cord compression. If it is sinusoidal, which is rare, it indicates there's severe fetal anemia. Okay. So it's a good practice. Whenever you go for delivery, please try to interpret cardiotocograph, CTG. Okay. So this is asking number 4. So please write interpretation of these symbols used for pedigree notation. So what does this first symbol indicate? Let us talk about first. Square and circle, dark square and circle. Affected male, female. Inner dot, carrier. Okay. What about second? Okay, what about third and fourth? That is simple. Third, Affected male index. Sorry, yeah, fourth is. Let us talk about the last one. What is the last one? Deceased. What is the second last? Affected male index case. Index case. The first is. Let us see what does it mean. Okay. So the first was affected. The second was non-penetrant carrier may manifest disease. The third was obligate carrier will not manifest disease. Okay. The fourth was proband. And the fifth was deceased as you all identified. Okay. But this is very important. Whenever you take history, it is a good practice to have a 3-generation family tree. And when you plot a 3-generation family tree, you need to know all these standard symbols. Please learn these symbols. It's very important. Okay. Okay. What is the diagnosis? What are the types? Write diagnostic criteria for this condition. Look at the baby. Very high drops. Mayur is saying. Raghuram is saying high drops. Raghuram is immune, non-immune. Any other diagnosis? Okay, very good. So this is hydrops fetalis. Okay. More than 2 spaces collection. So you can see there's a pitting edema. The baby is edematous completely. So this is hydrops fetalis. And hydrops fetalis is classified as immune or non-immune based on the etiology. When there's alloimmunization, it is immune. When there's no alloimmunization, it is non-immune. Okay. What are the diagnostic criteria? More than equal to 2 of the following findings, that is ascites, pleural effusion, pericardial effusion, generalized skin edema, or skin thickness of more than 5 millimeter when you do imaging or sonography. Okay. Very simple. Next, more simpler, right? 4 methods of postnatal assessment of gestation age apart from New Bullard score. Write the score for the picture shown here. And what is the lowest gestation age that can be assessed by New Bullard score? Let us start with the last question. What is the lowest gestation age? New Bullard score, 22 weeks, 22, 24, 22. Lowest 24. Mayuri saying 22 to 50. 20. Jay is saying, Mayuri is 20. Sanika is saying 20. 20, 44. Okay. Let us go to the second question. What should be the score of this baby? What is this sign called? Okay. What should be the score given to this baby? 3. 3. 2. Okay, we'll see that. Okay, and what are the methods of gestation age assessment apart from New Bullard score? Whatever you know of. LMP, okay. USG, okay. 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 What else? Dubowitz, Parkin, perfect. Dubowitz. What else? Okay. So we don't have much time. So you can see here, right? The lowest gestation age is 20. The minimum score is -10. The highest gestation age is 44. The maximum score is 50. So it is 20 to 44 weeks of gestation. This score assesses babies from 20 to 44 weeks of gestation. Okay. Now we see the picture here. Remember this picture. So this elbow is not crossing the midline, just at the midline. Let us see. So -1 crossed, 0 crossed, 1 crossed, 2 at midline, right? 3 axilla, correct? So what score should be given? 2. Okay. What are the methods? Other methods? Dubovitz, Ballard, rapid assessment of gestation age, where you don't use the neurological criteria, it's only physical assessment. Eye examination, also known as Hittner's, and EEG. USG also, and sometimes advanced technology like MRI. Okay. Write the diagnosis and write management as well. What is the diagnosis? PIE, PIE, BPD, PIE, PIE. PIE. Management? Gentle ventilation. HFOV with ventilation. Lung protective strategy. Gentle ventilation. Perfect, perfect. Okay, so this is PIE. Okay, you may get confused with bronchogram. However, the difference is these are coarse radiolucencies, and this can be seen in the peripheral and the middle zone. The air bronchogram is seen in the hilar area. Okay, so this is pulmonary interstitial emphysema. The treatment is supportive, and what you do is generally the affected side is kept down so that the normal lung gets ventilated. Correct? And of course, this is a part of air leak syndrome. So you manage the ventilation so that you do not increase the air leak. So gentle ventilation, preferably high frequency or high frequency jet ventilation. Okay. And the last OSCE, right? What is the study type? What is the diagnosis and treatment? What is the study type? What is the diagnosis? It is normal, it is abnormal. What is the treatment? If this is a 800 grammer, then if this is a 800 grammer, then what would be the treatment? And if this is a 2 kg, what would be the treatment? Lower the baby, vesicostomy, bigger the baby, valve fulguration. Okay, so this is a voiding cysto-urethrogram, and the diagnosis is post-urethral valve. Okay, I think that's it. Thank you.
Thanks,
Thank you.
Dr.
Thank you so much.
Such a nice, informative OSCE. I'm sure the students would have really learned a lot. So thank you so much for sparing your time. And
thank you so much. Really enjoyed.
Yeah. So that's it for today's session. So thank you to all the students for attending, and we'll see you next week then.
Bye.
Good night.
Good night.
Good night, ma'am. Good night, everyone.